Yes, welcome. I was carried by the music. Now, we are continuing with our topic about yesterday's topic, which is our topic was how the heart beats. And we talked about, you remember what we talked about? We talked about several issues about the heart, We talked about the normal conduction system of the heart. King Ray, welcome to the platform. We talked about the normal conduction system of the heart and the normal conduction system of the heart. What did we say about the normal conduction system? Starts from the AV node to the internodal pathway, then to the antrovesicular node, then to the bundle of His down there, and then it excites. And then the most important thing we talked about yesterday was this. We talked about any contraction is brought by negative charges going inside the cell and the auricle contracting so that it can push blood here, down here. And the other thing we talked about is very important is depolarization. Contraction means negative charges going in and it's depolarization. So if positive charges, and sodium are positive, so when they go inside, they contract. The other thing we talked about is the ventricles. When the positive charges are going through the bundle of E's and the divided bundles, they contract. So we talked and we said the normal heartbeat is between 60 to 100 beats per minute, and we call it automaticity. So automaticity is the normal beating of your heart, the normal heartbeat. But today we are going to learn what are the factors that are bringing this automaticity. We will come to learn what are the factors that are bringing this automaticity. How does this problem come? We are saying pathophysiology of arrhythmias, how it comes and the causes, Welcome everyone to the platform. Wherever you are watching from, this is Benjamin the Wise Guy, Dr. Ben, as what people call me always. So the most important thing that we are here today, if you have a question, as I usually say, drop the question in the comment. You drop the question in the comment so that we can know how we can help each other. And if you want to comment and say, Dr. Ben, you are so loud, you are making noise, please comment. So that we can laugh together. Now, what causes these problems that we are always thinking about? The heartbeat. Yes, good morning, Dr. Benjamin. Blessings to you, everyone in the channel. Welcome. welcome. That is Hilda Taylor. Welcome to the platform. I want us to learn what causes the problem, what brings the problem, the heart condition, how it comes. But the most important thing now we have talked about is the automaticity, the automatic. Yes, Uncle. Oh, it's okay. Yeah, it's okay, no problem. Okay. Yes. Now, the normal heartbeat, how does it come around? How does the normal heartbeat come around, and how does the pathological one? When I'm talking about Margaret in Norway, how is Norway, my sister? What's the time in Norway right now? It is I don't know. You tell me, Margaret, tell me. Today we are going to learn the problems that are brought by the causes that brings heart to run with a bad rhythm, either tachy or brandy. Tachycardia, we say it is faster heartbeat. Bradycardia, we say it is slow heartbeat. So what causes the faster heartbeat and what causes the slow heartbeat? So there is something called automaticity. The way it is, the way it beats, Finding Donna from Jamaica. Welcome to the platform, Finding Donna. I know this is your first time here, and I saw your comment from Jamaican's uncle. Welcome to the family. Welcome to the family. I think today we will not do so much. Let me push this here. Welcome to the family, Doctor Finding Donna. Yes, everyone here is a friend. It's my first time watching. Yes, Donna, I know it's your first time finding me live. Welcome. So there is this one called automaticity. What is automaticity? The normal way the heart beats and the normal rhythm, 60 to 100. So there is something I want us to discuss which is so crucial in the medical field and which is so crucial normally in the life of a person. There is something called parasympathetic system and sympathetic system. You see, now, sympathetic system is when you are how can I say, when your body does things without you telling it to do. Sympathetic system. Or in which language can I put? There is just a minute. I shut this down. Sorry. If you have a query as we continue, let's do. Today we are learning how the heart, the problems of the heart comes and how they are produced. So if you have a query according to them, you ask. So there is some the normal way your body relaxes yourself. It is called the parasympathetic system. And this parasympathetic system, there is a nerve in your brain, the cranial nerves. You have cranial nerves and you have the other sympathetic nerve. Sympathetic nerve is automatical way where your body helps you to fast do things faster, or you understand, respond to flight and fast run, yes, or activate yourself. So parasympathetic system is relaxation, and relaxation comes from a cranial nerve. That is, cranial nerve are nerves that are in the head. We have 12 cranial nerves. One is called ophthalmic, the second one optic, oculomotor, trochlear, trigeminal, you say that, facial, vagus nerve, hypoglossal, and then we have like 12. So the one that we are dealing with right now is the vagal nerve, like the optic nerve of the eye, the ophthalmic, hypoglossal, the tongue. You see, those ones help the tongue. Right now, we are dealing with what is called the cranial nerve number 10. Cranial nerve 10. And cranial nerve 10 is called the vagus nerve. The vagus nerve. It is vague. It goes everywhere. It does move everywhere. That's why it was called. Yes. Do a person have to take blood pressure medicine? No. Yes or no, Donna? Blood pressure medicine is yes or no. I'll explain. You have asked a question. I have to explain that question before you go. Now, we check. This is your head. This is your head. The brain. This is your brain. And then we have the spinal cord. The spinal cord. So, if you have the brain and the spinal cord, we have 12 cranial nerves in your brain. And the one we are dealing with is the 10th, which is the vagus nerve. And it comes to attach to the heart. It causes when your heart wants to beat so fast, or your heart wants to slow, it will be affected. The automaticity the automatic rate can either rush or can either slow. You see, when you are running or you are running away from something, your automaticity, the automatic ways of beating your heartbeats, that's what changes. So the parasympathetic nervous system is one of the most common that helps you up. Sorry, this one is disturbing me. Is one that helps so much when it comes to relaxation. And what does that mean? There are some things, there are some normal things in life that will make your heart to beat slow. Let's start with bradycardia, slow beating. And slow beating means it is reducing the automaticity, the automatic way of beating, the heart beating. So if you are coming in right now, we are dealing with issues that are affecting the heartbeat, issues that are affecting your heart to beat slow or faster, pathophysiology and how they come. So don't forget to give me a thumb and a thumb so that I can feel good. And people, don't forget to post your channels while you are watching me. So the vagus nerve is the first one. Reduced vagus nerve. How does it come? How it comes is this. The vagus nerve it releases something called acetylcholine. And when you release acetylcholine are what helps in the nerves. They pass transmissions. That's just like the electric tone. That is like the electricity. So we can say the electricity of parasympathetic nervous system from the brain, the nerve that comes from the brain, the cranial nerve, and goes to the heart so that it can maintain it produces something called parasympathetic nervous system, and that system is produced by acetylcholine moving. It carries the signals. Acetylcholine is the mother signal. So when you release acetylcholine, what happens? Acetylcholine increases this heart. It increases heart. It reduces the heartbeat. You see, more increase in acetylcholine, which transmits the impulse to the heart after you have been thinking, you have been doing what? It reduces the heartbeat. More acetylcholine reduces the heartbeat. Guys, like the video and almost 10. And my likes too. Thanks, cute Jesse. Today you have found me. Ask me any question. I know your questions are always out. Good question. I have one question from our new friend Finding Donna, and we have many that are coming. So the vagal tone, we call it 10th cranial nerve, the vagus. You know your body has all the nerves, but every nerve from the head, we have cranial nerves and we have sympathetic nervous system nerves on the back. So your cranial nerve number 10, when it comes to parasympathetic nervous system, it reduces the heartbeat. It makes your heartbeat slow. The tone, the vagal tone, when it is irritated, when you irritate the vagus nerve, and your heart will reduce in beating. And vagal tone, what can make your vagal tone? What can make the vagal nerve, the cranial nerve number 10? I've said we have so many cranial nerve. One is vagus nerve number 1, ophthalmic, optic, oculomotor, you get it. Trochlear for eyes, trigemina, all those. We will learn about them, but let's deal with the heart first, number 10. So what can make the vagal tone to increase? You excite the vagal tone, and when you excite the vagal tone, it produces more acetylcholine. More acetylcholine, the transmitter goes to the heart, and then it reduces the heartbeat. So your heart beats slow. If you irritate the vagus nerve, it will release something called acetylcholine. And acetylcholine is the mother of slow heartbeat. So it's a neurotransmitter. So guys, hit the like buttons as we go. And if you are hitting the like button, follow me, man. Like and share this video to students, to everyone. So we continue. So here we have what can make the vagus nerve to release more acetylcholine, to make acetylcholine to come up so that when it fends the heart, it starts to beat. One, when you want to relax, you've been working the whole day and you want to relax. You are in your bed and you are tired. One, guess one? The first one is sleeping. So sleeping reduces resting. That one I'll call it resting. Resting reduces your heartbeat. Your heart beating slow. Some of you at night, your heart beats less than 60 beats per minute. You get it? Your heart beats less than that. And then there is something else that I will say. There is MI. You remember we talked about MI? MI, myocardial infarction, inferior. If this heart has a wound, at a particular point inferiorly and it's blocking the waves, what will happen? You will have a low tone. The automaticity of this heart beating, will go down. It will be low. You will have a low heartbeat. Guys, if you are watching, please have your like, and let's do what? Let's continue asking the question. I have one question from Donna, and I have the others that are coming. So the other one, what we talked about, athletes, you like running, you like exercising so much. What happens to your heart? Your heart ventricles become so strong, so tough. Even contraction, sometimes it is slow because tough muscles and their hard contractions become slow. So it reduces the heartbeat. So if it reduces the heartbeat, what happens? You have bradycardia. Your beat will be. That's why people that run so fast, when they are seated and they are relaxing, their heartbeat is slow. Welcome everyone who is coming in. And now let me finish the automaticity of heartbeats beating slow. Then we go to the question of Donna, our new friend today, Donna from Jamaican's Uncle Channel. Welcome to the platform. There is other things that we learned previously that can make, you have said, the things that can increase the vagal tone. We have said sleeping. We have said athlete's heart, exercise. So hard exercising. And then we have said inferior MI, mitral myocardial infarction, slowing the heart to beat, increasing the vagal tone. We have said the vagal tone, if you excite the vagal tone, it will release acetylcholine. And releasing acetylcholine means what? It means your heart is releasing a lot of neurotransmitters, those transmissions that your nerves pass, and it means it will reach the heart, and the acetylcholine will make your heart beat slowly. If you don't know what acetylcholine is this nerve that comes from the head. It has to pass transmissions to the heart, and the transmissions are carried through acetylcholine. And the effect of acetylcholine is low heartbeat. So if it comes here, it has low heartbeat. What you are dealing with right now is things that can make acetylcholine to be excited, or exciting the vagal nerve. Yeah, you see that? So we have said exciting the vagal nerve. We'll talk about vagal tone, sleeping, athlete because of tough ventricles, inferior MI, myocardial infarction, a dead space within. Susan, welcome as you like. Please like the channel. And then we have inferior, we have other things, like slow AV conduction. AV, atrioventricular conduction, slow. Your heart can beat slow because of slow AV conduction. This is one. And then we have two, slow AV conduction. AV conduction means this one. This atrioventricular node is passing waves so slow. So if it is passing waves so slow, what can make? Drugs. You see, drugs can make the AV to go slow. Drugs like beta blockers used in hypertension, calcium channel blockers, and digoxin used in heart attack. drugs can make your heart to beat slow. Drugs like beta blockers, channel, calcium channel, and digoxin. Digoxin. Those that use digoxin, you know, it makes your heart beat slow. Now, let's go to other things like metabolic activities. Your body itself can make your heart beat slow, like metabolic activity. This is the second one we have, metabolic. Metabolic. We learned about the thyroid. We went through the thyroid last time, and you can remember so well that the thyroid, when you increase, sorry, this is misbehaving here. I'm trying to fix it. When you increase the T3, when you increase the T3 in your circulation, when you increase the T3 in your circulation, what happens? T3 increases metabolism. You see, T3 increases metabolism, and if it increases, sorry about that. If T3 increases metabolism, if you didn't go through how the thyroid works, go through. When the thyroid likes have a thyroid issue and your hyperthyroidism is high, you have hyperthyroidism, what happens? The hormone T3 increases. You get it? So what happens? T3 increases metabolism. If T3 increases metabolism, what will happen? The heart hypothyroidism, the heartbeat will go down. No, sorry. When T3 is low, hypothyroidism, where T3 is low, the heartbeat will go low. You get it? Because metabolism is slow. So the heartbeat will go slow. Because if metabolism is slow, it means your heart is passing blood, taking oxygen slowly and slowly. You understand? Please like the video. Give me a comment. Give me a comment as you like. So in metabolic activities, we have hypothyroidism and increased potassium. In some cases, you can be sick and you have increased potassium. Increased potassium brings a problem. Your heart will bleed slow. There is something called high intracranial pressure. Has anyone in the group heard of raised intracranial pressure? The pressure of there is a fluid in your brain that covers the brain, and it makes your brain be cushioned inside so that you cannot have an injury of the brain. So the fluid moves, surrounds, but when it is too much, it is called increased intracranial pressure. The fluid is sorry about that. So the fluid, when it is having pressure and you're feeling that your headache is beating, what comes after that? You get hypertension. The other thing that you get is, sorry, I'm trying to set something here. Sorry about it. Sorry. So the other thing that comes is your heart beats slow, but your heartbeat, you have hypertension. It is the opposite. Slow heartbeat with high hypertension. You get it? So when you have these two, when you have hypothyroidism, high potassium levels in your system, because of kidney injuries, sometimes you are not getting the normal regulation. You get it? Those people that have kidney injuries, you don't have normal regulation of electrolytes. Electrolytes are like potassium, sodium, and others like, you understand, those ones. You will have a problem with having the potassium level. So when the potassium level rises, your heartbeat slows. You get it? So those are the problems we have, that we can have the thyroid function, the cranial nerve, irritability, and we have seen things that brings the cranial nerve irritability. If you don't know what the cranial nerve is, you can ask, I repeat, but cranial nerve number 10, which is the vagus nerve. Yes, let me answer the question of our sister here. Can let me find the question. The question was, can someone live without taking? Let me get it. The question was, can someone live without taking? Is it a must a person to take antihypertensives? Antihypertensives, you can take them if your doctor has told you, if you don't take these drugs, this will happen. Sorry. If you don't take these drugs, you will lose, you can get a brain injury or so. And I've said, and I've always said, if your blood pressure is being brought by associated issue, if is it my Wi-Fi that is buffering or it's on your side? No, my my side it is okay. I think it is your side. Your side there is a problem, Macy. Mine is okay. Everyone, anyone who is here who is having the same problem, please say. Now I was saying, I'm answering our friend who is the new friend today. If your blood pressure is brought by an associated disease and the disease is treated and it has gone, your blood pressure can balance through your doctor taking you through the normal ways we take and tapering you off the medicine. But if your pressure is long term, because of maybe it's genetic or so, or after a disease. Hi Benjamin, how are you, bro? I'm fine. Hajiways here following the back. Video is running as yes, thanks a lot. Thanks a lot for following. So you can talk to your doctor and ask, will I take these drugs for long? Do I have an associated disease that are making me stay to these drugs? You get it? And Donna, please go to our video when we were talking about the renin angiotensinogen system. You will know how it comes. You see, that's why we put these videos and we leave them there. Now, we have talked about how your heart. If you have a question, I've answered Donna. Thanks a lot, Hajiways. Thanks a lot. If you have a question, please ask, and please give me the likes. If you have a question or you're not following, please just ask me. I'll answer. I want to go slow so that people know. So we have other things that can make you increase the vagal tone. This one is how you can have this one. I was talking about the parasympathetic system, how it is reducing the heartbeat, Now, we want to talk about the sympathetic nervous system, the one that helps you run when you have a problem. When when a lion comes, when you are in the jungle, you look at the lion and then adrenaline comes in, and then you want to run, your heartbeat starts to pump faster, and other things that can help, can make your heart to pump faster. That one is called increased automaticity. The heart is pumping faster to give your brain oxygen. You get it? To give your brain oxygen. So what are the things? As you come in, please like the video. Let's learn. Let me remove this stethoscope. It is making people be scared. Now, there are some things that can make your heart beat faster. We have talked here about reduced. This one is called the parasympathetic system. Will be back. Let me check on it because yes. Okay. Parasympathetic. So what is the other way round that can make your heart beat faster? Even sometimes when you are not sick. It is called the sympathetic nervous system. Now, sympathetic nervous system at your back, the spinal cord, those bones, they are the nerves that come out at the spinal cord here. They are the nerves that come out from those bones. So from the bone, they are from here. We have lumbar, we have thoracic. So when from the nerves that come from this is from T1 to T5. The bone from T1 here from your back, just below, to T5, to T5, to T5. There are some nerves that come, and these nerves that come from here, they come and excite the heart. These ones that come, they are not coming from the brain, so they are not cranial nerves. Guys, please, if you have not given a like, show me love, man. Show me love. If they are nerves that help you see, there are nerves that help you control your eyes, there are nerves that help your tongue, there are nerves that do all these things to help you go on with normal life. Hearing, you see, they come from the brain. They are called the 12 cranial nerves. But there are other nerves that come through your spinal cord down. So from T1, the bone from, they are arranged like this. If you touch your back, you will hear some small bones. They are arranged up to down here to lumbar. So there are some nerves that come. Those ones are not called cranial nerves. They are spinal nerves. So will your heart beat faster if you sleep on the side? Yes, I'll answer that. That just now I'm answering that now. Smile in the city. Now, what happens from the first one, T1 to T5, they produce sympathetic nervous system. Fight, when adrenaline is up, it excites the sympathetic nervous system. It excites the sympathetic nervous system. And if it excites the sympathetic nervous system, okay, I have to have another paper. If it excites the sympathetic nervous system, what happens? The sympathetic nervous system is, now your heart is beating so fast. Now, your heart is beating so fast. The sympathetic nervous system. What happens when the sympathetic nervous system is excited? What happens when the sympathetic nervous system, that is opposite of parasympathetic. Sympathetic is, does taking a lot of coffee make the heart beat fast? Yes, it can. Let's see now we are talking about what things can make your heart beat fast, and that's why we are talking of, okay, let me explain something before I continue so that people can understand. We have talked of automaticity. Automaticity is the normal way your heart beats at 60 to 100 beats per minute. 60 to 100 beats per minute. But there are some things that can make it beat faster or slow. So we started by slow. And by slow, we talked about the nerves from the brain. One of it being the 10th cranial nerve called the vagus nerve. The vagus nerve, when it is excited, it produces acetylcholine, which carries the transmission to the heart. So when you increase more and excite and it produces more acetylcholine, your heart beats more slowly. So that's why we call it the parasympathetic nervous system. That one is PNS, parasympathetic nervous system. And we've said, what are the things that can excite the cranial nerve to excite more acetylcholine so that the heart can beat slow? We said this: sleeping, when you are relaxing, the parasympathetic nervous system excites the cranial nerve. 10, to produce more acetylcholine so that it can relax the heart to beat slow. Athletes exercise. Those people that exercise so hard and their heart muscles are so strong, they produce more acetylcholine and the heart muscles beat slowly. And then we have MI. You remember when we talked about MI? on this heart. When you have myocardial infarctions, a place in the heart that is dying and cannot pass electrons. So it beats slowly. That's what we say. Now we say we have something called slow AV conduction. What can cause? The other thing, drugs that you take, calcium channel blockers of BP, high BP, like nifedipine. Another one we have talked about is like, we have talked about like beta blockers. Those ones are used in BP, and digoxin that helps your heart to beat slow. Then after we have done with that, we talked about metabolic activities like the thyroid, how the thyroid works. If you have hypothyroidism, what will happen? You will have less T3 hormone, triiodothyroxine, T3 hormone, that makes your heart beat slow. You get it? It will make, if you have low T3, you will have your heart beat slow because the body is not asking for more oxygen from the heart, from the blood, so your heart is not pumping faster to give your energy, so it pumps slow. That is an automatic thing. And then after there, we have talked about now the opposite. Now we are welcoming the opposite. What can make your heart beat faster than you can imagine? What can increase automaticity? What can increase automaticity? Yes, sympathetic nervous system. That I'm saying, there are nerves that come now from your spinal cord, from the first bone thyroid, the first bone to the fifth bone of the spinal cord, and the thoracic bones. They are called thoracic bones, and those nerves come and excite the heart. You get it? That is increase in sympathetic nervous system. And there are some things that can make increase in sympathetic nervous system. What are the things that can make sympathetic nervous system to increase? To increase so that you have a heart that is beating so fast. Yes, we have hypovolemia. Hypovolume. Your blood volume is so low and your heart is beating so fast so that it can send enough oxygen to the brain, because you don't have enough volume of blood. Maybe you are cut and you have bled. Maybe you are diarrheaing so much. Maybe you get it. I'm busy, but I'm running you live, brother. You received a video later. Thanks, cute Jesse. Thanks, cute Jesse. Hypovolemia. You are diarrheaing. You get it. Those are the things that can make your heart to beat, increasing the sympathetic nervous system. You get it? And then we have another thing like lack of oxygen, hypoxia. Lack of oxygen is called hypoxia. Lack of oxygen. It makes your heart beat faster. And what can bring lack of oxygen in your life? What? One is infection. Two is lung disease, diseases of your lungs. If your lungs are having problems, you will not have enough oxygen. And then something called pulmonary embolism. You remember about what we talked in pulmonary embolism? Something blocking the coronary artery disease. The coronary artery that comes and serves this heart with blood and nutrients. If something, an emboli like cholesterol, and then a blood clot can block it or constrict, or you get it, this heart will not get enough oxygen. That is why we say hypoxia. It is hypoxic. So that one is called pulmonary PE. We call it pulmonary embolism. And then we have some other things that I'm talking faster today. Please, if you have a question, I'm here. Who has a question before I continue? And I'm seeing the likes are coming in, my friends and my sisters. I have a very nice sister in the platform called Margaret in Norway. Yeah? Thanks so much for being here, my sister. Thanks so much for being in the platform. Now, we have some other issues that can make your heart beat slowly. Sympathomimetics, drugs can make you see the drugs that are working as sympathetic nervous system to, like, there are some drugs that when you take, they accelerate your heartbeat. Those drugs are called sympathomimetics. They can. Yes, Margie. There are some. When we come to management, now we are just talking about the problems. Management will come and you will see the drugs, you will see those pacemakers, you will see all those. Let's deal with the problems first. We explain, then we go to drugs. And now we have another thing called uh, some drugs that you take for pain and some drugs that you take for anxiety. They act as sympathomimetics. So when you take them, you start feeling your heart beating so fast. Have you ever taken a drug and then you feel that you are feeling your heart is beating so fast? Just know that it has excited that sympathetic nervous system. Now we go to another important thing. There is some drugs that you take, like for the stomach, like macrolides. Macrolides are like there is a very common drug that you take for 3 days. That is an assignment, an antibiotic that you take for 3 days, and that drug really makes you increase. You check it out. Before the end of the, I'll ask who has gotten it. I've given you. People use it so much. Yeah, it's a macrolide, but I want the name. It is misused. That drug is misused. So we have talked about things that can make your heart. There was a question by Smile in the City asking, will your heart beat faster? Will your heart beat faster if you sleep on the left side? No. Position sometimes does not have effect. Position helps in regurgitation. If you sleep in the left side, foods will not come back because your stomach is lying in the left. So it will help you in digestion. You get it? But choking, if you always if you always sleep in the right side, you are at the risk of choking at night. Sometimes when you sleep on the right side, food comes back on there and then you feel choked. You feel choked. Now, we have talked about issues. If you are not understanding about the parasympathetic nervous system and sympathetic nervous system, please ask so that I can explain well. I've explained about the parasympathetic nervous system, which is brought by the vagus nerve, and I've explained about the sympathetic nervous system, which comes from the lumbar nerves from the lumbar region. Please, my guys, don't just go without giving a like. Come in, give me a like, let me feel good, share the video. And then I've said metabolic activities like the thyroid function and other things. But there are some things that we really need to understand that can also bring the problems of your heart beating faster. Your heart beating faster, tachycardias. You get it? What can make your heart to beat faster? What can make your heart to beat faster? Let's see the things that can make your heart to beat faster. Here we have talked about automaticity, the difference of sympathetic nervous system and parasympathetic nervous system. The sympathetic and parasympathetic is automatic way how your body handles things when it is excited. That's why I've talked about these things here too. Rewatch and let's see what you think about it. Now, triggered activities. Triggered activities are very important. There are some activities. Uh, Let me use this paper. Triggered activities. Triggered activities. Triggered activities are things that can make you get some low potassium or make you your electrolytes. I said electrolytes are like potassium, calcium, you see, and magnesium and magnesium. What can make you get these problems? What can make you get these problems? It is important to know what can make you get problems of your heart, hmm? beating so fast, beating so fast. What do you do to yourself to make your heart beat so fast? There are some things that you can take, like our friend Macy has told us about caffeine. It is true, it can take, but there are some drugs that you can take, some drugs that you can take. There are some drugs that you can take, and those drugs really make you feel bad. The drugs, I'll give you a simple way of how to know the drugs. We call the drugs A, B, C, D. You get it? And E. You just write this A, B, C, D, and E. So these drugs that I'm going to write here are the ones which can make your heart beat so fast. But the first thing you should know, this side you write anti, arrhythmias, antirhythms, those drugs that block potassium, those drugs that, you see, block the calcium from your body. The second one is antibiotics. Antibiotics can make your, we have said A, B, C, D, and E. Antirhythms, antibiotics. And there is I've asked people, which drug do you take when you feel that you have a problem? You run to take that drug so faster. For 3 days, one tablet for 3 days. Please answer me before I say it. Who will win that prize? Yeah? There is a drug that people really use, that they really love. You don't want to take drugs for so long. So you go to the pharmacy and tell that person, give me that drug for 3 days. That antibiotic only people take for 3 days. Eh? You know it. Now people have gone silent. You know, I know you have used it once in a while. 3 days antibiotic. What is it? They are called macrolides. That's another hint. Who is gonna hint? No one knows it. Okay, let me say, macrolides are drugs like King. Judy has won it. I'll send Judy 500 today. Okay, let me send Judy. I'm sending you something. Let me check your number right now. I'm sending you something for winning that. Let me check your number. This is who? Uh, Let me send. You have won the prize. You have won the prize. You really need it. I'm sending you something right now because you have won the prize. That is. Let me get your number. I know I have it somewhere here. This is just a minute, guys. Just a minute. Judy has won something, and she needs the prize right now because I will forget. So let me get to find it. I'm finding Judy's number. Judy, I've sent you as Judy. Let me send you your prize right now. That is 6, 7, 27. Judy has guessed a macrolide that people used so much. and the price is for her. Let me send the price for her. That is your price, Judy. Is coming. If you have got it, please confirm. Confirm if you have got your price. If you have got your price, please confirm. If you have got your price, please confirm. Okay, we continue. We continue. That drug is called azithromycin. That drug is called azithromycin. Azithromycin is an antibiotic. They are called macrolides. Macrolides are we have said, you say A, B, C, D, E. A, B, C, D, E. So, anti-rhythms, these ones can trigger, they are called triggered activities, can make your heart beat so faster, beat so faster. Anti-rhythms, antibiotics, like macrolides. One of the macrolides is called, the one that Judy has gave us, and it is right, it is called azithromycin. Azithromycin. And then we have C. What is C? Sir, welcome, welcome, Judy. You've guessed it right, you deserve it. Cyanotic antipsychotics. Those people that take antipsychotics, drugs of the brain. You know antipsychotics. Antipsychotics are psychotics. We are saying you put here anti and then psychotics. Antipsychotics. So antipsychotics are the drugs that people are having, and they are bringing triggers. They are giving your body problems to beat faster. Antipsychotics, a drug like haloperidol. If you have ever seen someone taking something like haloperidol, haloperidol is an antipsychotic. And then we have something called, we have antidepressants, tricyclic antidepressants, something like fluoxetine, antidepressant. If you have ever taken antidepressants. So we continue with the logarithm, antidepressants. Antidepressants are those drugs that make your heart beat faster when you take them at times. And then the last one, E, when you feel like vomiting, you you take a drug so that it can make the nausea go away. The only thing that those drugs do, what they do, they increase the motility. Food to go through the stomach faster, so that what can happen, you cannot feel to vomit. You know, when it is called motility. Motility is when your food is moving through your stomach. It is called motility. So, antiemetics. You have said antiemetics. Antiemetics. Drugs like which ones? Drugs like aldosterone, metoclopramide. It is called placin, metoclopramide, placin. That helps your what? You not to vomit. You get it? You not to vomit. Now, those ones are things, even some foods, drinks with caffeine, pepper. Those are things that you are not supposed to overuse, because you will have a heartbeat that is running so fast. Now, we have another issue. When it comes to that one, I have to use. Yes, we have another issue that is very important. Let me get a manila paper. We talked about it. If you have any question, my friends, of anything, not even in the topic of arrhythmias, please bring that topic we learn. Ask so that we learn. Anyone with anything that needs to be addressed, please come in and let's help each other to think. There's something I want to explain which is so crucial. That is so crucial. Something I really, anyone with a question before I continue? I want to finish the pathophysiology today. Anyone who has a question to there or any other question that you feel you can ask doctor, please put it on so that we tackle it. Anyone with any question? Anyone with any question? I'm waiting for questions, or you have not understood somewhere and you really need to know about it. Just ask. Ask, we see. Just ask, we see, as I prepare the. Yes, yes, yes. There are some things that you really need to work on, and they are so important to know. We have something called early. We have something called early after depolarization. Early after depolarization. Things that can make your heart to beat faster or slow. We are now on faster. We have some things called EAB, early after depolarization. If this is your cell, if that is your cell, we said depolarization means when your positive cells are coming inside the cell, and it means something like sodium that has positive cells coming inside. So there are some things that can make your ventricles to depolarize so fast. They can make your ventricles to depolarize, to contract early after depolarization. Yeah? There are some things that can make you to have it, to get faster depolarization, your cells to get positive charges so fast. Those are things like the ones that I've said. I've said the, where is that paper? You have said like anti, let's go, antibiotics. The other one, antipsychotics. The other one, antidepressants, anti-diabetic. And then we have delayed after. Delayed after, we have delayed after depolarization. DADs, delayed after depolarization. Those that make you to have a delayed depolarization, your muscles to contract in a funny way, slowly and then faster. In delayed after depolarization, in delayed, yes, yes, thank you, Margie. Thank you so much. But if you don't understand anything or you have any question away from what we are talking about, please just ask. So things like ischemia, delayed, what can make your impulse of the heart to delay? What can make your impulse of the heart to delay is something like one, ischemia. Ischemia is no oxygen. No oxygen, lack of oxygen. Hypoxia. Hypoxia. Maybe you have a lung disease, hypoxia, lung disease. You have a lung disease that is making you not get enough oxygen. This can be a problem. There is other things like stretch. When the muscles, you see, when the muscles of your heart, let me bring this here slowly. When the muscles of your heart, when these muscles of your heart, they get a disease, and then it starts to make it swell and stretch, what will happen? It will have a delayed impulse, myocarditis, infection, myocarditis, infection. This is 3, infection. Myocarditis is infection of the heart muscles. Infection of the heart muscles. This one can make you to have a delayed impulse that goes through your heart. And when you have a delayed impulse that is going through your heart, what will happen? You will start having problems and faster beats that are not coordinated. You get it? Digoxin toxicity reduces the heartbeat. Digoxin toxicity reduces the heartbeat. You get it? And it increases sometimes sympathetic nervous system. You get it? Like mitral infarction, MI, myocardial infarction. Myocardial infarction can make opposite. It can increase or reduce according to how and where it is. Now, there is something before I finish today that is very important. After today, we will go to next topic that we are learning. We will go to what? We will go to treatment, how we can manage all these conditions that we have named. There is something that is so important that I want people to understand about something called, you remember when we were talking about, let me sit down for a while. You remember when we were talking about types of tachycardia, and we said we have sinus tachycardia, we have focal atrial tachycardia. We said we have, you remember them? Let me name them. Let me go a bit from the beginning. When we said your heart can beat faster, and I introduced and I said it depends with where it is receiving the heartbeat. So we said one thing. We have something called sinus tachycardia. When this sinoatrial node is beating, is producing waves so faster. And then we said focal atrial tachycardia. You see, at this part of there are some people who are born with a heart that has some points that are having heartways, seeing you, that have some points that are producing electrical nodes, just like the sinoatrial node and anterior, and we call them Kent bundles. They are here. We call them Kent bundles. That one, you are born with it, and it is a patho. If you have not liked my video, please like it. The Kent, you are born with something like sinoatrial node, which is producing some waves, some electrical waves that it should not be there. So we said when you have it, it produces waves. You see the normal wave, when it beats, it comes back or it goes direct to the heart. Focal atrial tachycardia. But when they are many, we said they are multifocal. When they are beating so fast and you can't pump blood, we said they are called fibrillations. You remember me saying this one. The normal one is pa, 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 pa. Tachycardia. Pa, 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 pa. You get? And then fibrillations. You can't pump blood. It moves so fast. So the sign pa, pa, normal. And then pa, 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 tachycardia. Fibrillations. That one cannot pump blood. And then there is which is atrial flutter. Now it is so fast and it is flat. The wave is flat. But there is something else we mentioned. NV and AVRT. We mentioned A. You remember this? AVRT. This is called atrioventricular return tachycardia. Atrioventricular return tachycardia. This is in the people that are born with the pathology. They have another sinoatrial node fiber that is beating here. That is beating here. You get it? So when you produce the signal electric, it comes and it goes. This one, when it goes here, it returns back to the atrioventricular node. Instead of coming back down to the heart to complete or to come to the Purkinje fibers to come down, it rotates. Now the process rotates. The process rotates. You get it? This is called AVRNT, atrioventricular return tachycardia. This one is firing, giving electrical impulses. It goes up to the Kent fiber. Kent fiber, because it is automated and it has electrical impulse, it fires back and comes to the atrioventricular node, and it goes continuously. You see, those people that are born with Kent bundle, they have this problem. They go to hospital, they are done an ECG. An ECG, you remember what we talked about, and they are told you have a Kent fiber, which means this, instead of it, when this one is producing here, it's bringing, let's see the normal wave. Let's go back to the normal wave. The normal wave is like this. The sinoatrial node beats, brings down to the atrioventricular. After some time of filling the ventricles, it takes electrical system down and down back to the bundles. Now, if you have this, you are born with a Kent fiber here. It is always at the left side of your heart. Yes, greetings, Botswana. Welcome to the platform. When you are born with a Kent fiber, what happens? When sinoatrial node brings here the electrical wave, polarized, and you know that where the electrical wave goes, everything contracts. It means it is sending contraction, so that where if blood is in this atrium, it is pushed to the ventricle. So this happens. It pushes, it contracts, it comes down. It normal. It is pushing the waves normal. It comes back here normally, and then it goes back. Instead of depolarizing, it continues the circuit. The circuit goes to the Kent fiber and then comes back. You see, it is re-entering. It is re-entering. You see that? So this one is called atrioventricular return tachycardia. When you have the Kent fiber, now when this beats, it continues the circuit, because the circuit normally should be, when it has depolarized, it stops, it repolarizes. So this one, it doesn't repolarize, it doesn't relax, it continuously sends the signal round. So your heart beats like this. Tachycardia. You get it? It makes your heart beat faster because the signal is re-entering. It's re-entering. The circuit is being complete. It is like a dead diode or a connection whereby all the signals are passing continuously. You get it? Because the heart should have, when this one goes here, it contracts. It has a delay to fill the right bundle. When it has a delay to fill the right bundle, it goes to these fibers, Purkinje fibers. They are called Purkinje fibers. as it contracts, when they're going to the Purkinje fibers, it gives some time so that all blood can go, and then it, after this one has repolarized, it opens up again. So it returns the signal again. But right now, the signal is continuous because someone was born in the heart with something called Kent fibers. They are pathologic, they are not good, they are a mistake. So it continuously gives the round signal. So the heart continues to beat. You check it out, people. That one is atrioventricular return tachycardia. But we have another one which gives you a faster heartbeat, which is called atrioventricular nodal return tachycardia. We have added this called nodal. It is within the nodes. It is within the nodes. Let's take a node like the sinoatrial node, like this. We separate, just like as it is, like that. This is we have taken the sinoatrial node, this one. But now our sinoatrial node is divided into two. You get it? It's divided into two. Normally, they are divided into two. Wait a minute. No one has a question up to there. If you have a question, I've taken this now. I'm explaining. This one is reversed because of the Kent fibers. But this one now, atrioventricular nodal return tachycardia, is a different one. It's a very funny one. This one is now this node of yours. This sinoatrial node has a problem. Our sinoatrial node has a problem because when the side is coming here, that inside the sinoatrial node, what happens? It brings depolarization. And after depolarization, it takes down through these two branches. You get it? It takes down through those two branches. So you will find that part of this node has died. Let me use a red pen. Now this node, part of it has died or has a problem. We call it, this part has a problem and this part is died off. So this is what will happen. When the positive cells are coming in, sending signals down to this here, you will get this side depolarizes faster than this side. So when the signals have gone, this one is still sending the signal and this one has depolarized. So what will happen? You will have a continuous wave. It is depolarizing. So small depolarization units are going down, but this one is still having a continuous depolarization within itself. Because now there's the other side, which is the polar side, and the other side has died. So this one is contracting so slow, and this one is contracting faster as normal. So it is sending signals in a funny way. So the signal is coming round within the node itself. So we call it, and as this node is doing what it's doing, your heart is pumping so fast with irregular rhythms. So we call it atrioventricular nodal return tachycardia. But atrioventricular return tachycardia is beating so fast. How your heart beats so fast is because the people that have born with the Kent bundle, which is pathologic, and it is giving this side a continuous signal. So your heart is beating faster. But atrioventricular nodal return tachycardia, it means this side of the sinoatrial node, what is it doing? It is returning the positive charges continuously within the node. Instead of it taking directly, it is continuously having a fight within itself. You see? Those are the things that can make your heart beat slow and beat faster. That one is called a re-entry tachycardia. the one that we talked about in the beginning, types of tachycardia. If you saw the video of introduction, you will see those things that we talked about. I will repeat types of tachycardia. Let me write them down. Maybe someone may be interested with knowing what we talked about. We talked about, I will write them down here so that you know. We talked about sinus tachycardia. When this one is beating, sinoatrial node is beating so fast. We talked about sinus tachycardia, 1, 2. And then we talked of a pathology whereby someone has a Kent bundle. You are born with a Kent bundle that is pathology. So it is bringing in, as this one is firing, this one is firing, and your heart is beating fast, it's beating fast. We called it focal atrial. Tachy. Focal atrial tachy. And then we said, if you have this one, and there are some small places that others are beating, what did we call that? We called that multifocal, because focal is one. So we have several. So if we have several, what is several meaning? It is called multifocal. Number 3, we call multifocal. Multifocal tachycardia. And then we said, if they are beating so fast, the signal of your heart is so fast, it is called fibrillations. It is called fibrillations. And then we have the 5th one, after fibrillations, flutter. Now it is beating so fast that one of my nieces was born with that too, and she lives only for 6 months. You see, these things that I'm talking, they're not, they are there. You get it? Now, we have something called arterial flutter. It's beating so atrial flutter. Atrial flutter. Atrial flutter. And then we have these ones. A that I've just explained, AV, R, T, and AV, N, R, T, which is atrioventricular return tachycardia. And then the ventricular return tachycardia is the one that we are saying you are born with a Kent here that is firing. There is another one that we have atrioventricular nodal return tachycardia, which is nodal. Now, the sinoatrial node has the problem. You see, now these ones are 5, 6. They are the ones that are types of tachycardia. And then we said we have some other types of tachycardia that are ventricular. These ones we were talking are supraventricular. You cut here, we talk about what is up. So these ones are supraventricular. Supra, high, above the ventricles. And we just saw about what the below the ventricles meaning. So now, as we speak, you've seen that even Jamaican uncle says one of the nieces was born with it. One of the nieces was born with it and he passed on. We are sorry about that. I wish I got your niece those days. We could do something. Maybe it was they knew late. Maybe they knew late, and that's why your niece passed on. But it's okay. It can be corrected. It's something we will see as we start our talks on how we can treat the pathology. We have gone for more than 1.5 hours. Now, what do you think? Is there a question that I have not answered? If there is a question that I have not answered, please tell me. I think I've answered all the questions. Anyone with any question about the heart? the heart has, we have talked about parasympathetic nervous system and the sympathetic nervous system. Please rewatch and know that how they work. Things that can make your heart beat faster and things that can make your heart beat slow. We have talked about them, and we have talked about the sinus tachycardia, the nodal complication, and the people who are born with the Kent bundle. The people who are born with the Kent bundle that makes the heart beat faster every time. Every time it is returning the Kent bundle and it is beating so faster. So anyone with a question as I continue to finish? Let me check if there is any question. Yeah, Messi asked about food, and I said yes, it can increase. Sometimes you can take alcohol and coffee. Alcohol, what it do when you take alcohol, it makes your nervous system slow, but it destroys your electrolytes. Electrolytes are filtered in the kidney. So when they destroy your electrolytes, and you have seen electrolytes when it comes to the tachycardia, let me open here. Potassium, magnesium, those are metabolism. Those are metabolic activities. Metabolic activities, increasing potassium, electrolyte imbalance, those we have talked about them, what they do. No more alcohol. My sister, when did you start taking alcohol? I don't know like that. Hey, alcohol, how many hours of sleep you need to rest the heart? Okay, your heart, you need a good rest of 8 hours. 8 hours, because when you are sleeping, your heart rests and beats slowly, and the muscles get the energy and they are rejuvenated. So best sleep is 8 hours, but because of economic activities, we need to feed for our children, for our family, and many other things. People sleep for 6 hours, which is not so bad, but at times you have to compensate, because you will find sometimes in your weekend you sleep more than you were sleeping in the weekdays. When I was a kid, I knew someone who was born with a hole in their heart, and they did uncle, a hole in the heart. It is called foramen oval. Foramen oval. That one is very important topic. We will talk about it when we are talking about children and the complications of giving birth. Children, let me explain about that a bit. I think I've explained about that Betty's world, about sleep time. When a child is in the mother's womb, the blood does not circulate in the heart normally. It circulates, instead of going round to the lungs, because now the lungs of a child are not active. How does this child in the womb get oxygen? How does this child in the womb get oxygen? And this child is not having lungs. Have you ever wondered about that? Just a minute. Now, when a child is young and a mother is carrying a child, then yes, it's a puzzle for me too. Now, I want to explain because it is important. I think I should have explained it so fast, sometimes ago. It is important that you've come. If you are coming, El Marie, now you've missed a lot, but you'll rewatch. I missed you too, El Marie. Thanks for coming. Don't miss to give me a like. Don't miss to give me a like. Now, I want to explain something that Uncle has said. The blood comes from umbilical cord of the mother. The blood, but you'll rewatch, no worry, just give me a like and share. The blood comes from, can damage valves be corrected in yes, it can. That's when we give some, I really want to explain that point that Jamaican uncle has brought. I really want to explain about it. Look at this. From the oxygenated blood, Jesse, where have you been? Thanks a lot for coming. Thanks a lot for coming. We have really talked a lot and people have learned. Please rewatch this. Please rewatch. You will feel nice. You will feel nice. Oxygenated blood, everyone, listen, this is how a child in a mother's womb, the question that Jamaican uncle has given is, when I was a kid, I knew somebody was born with a hole in the heart and they did die by 12 years. So I want to explain how a circulation of blood in a mother's womb is so that we can understand that question. Oxygenated blood from the umbilical veins passes through the venous, it goes to the liver of the child through the vena cava. The vena cava. You remember the vena cava? This one. So which one do I use? Let me use this one. So it comes through the vena cava. You get it? It bypasses the liver through another vein that children have. It is called ductus venosus and enters the inferior vena cava of the heart of a child. And when it comes to the right atrium. So imagine this is a heart of a child. You get it? Imagine it being a heart of a child. Now, as it comes here, it is from the liver now. The umbilical vein of the mother has a vein that goes to the liver and comes down, attached itself to the heart of a baby. Now, this is the heart of the baby. And remember, it is taking blood from the mother's womb, the mother's liver. It bypasses through the mother's liver. It reaches the blood to the right atrium. Now, here, there is something called foramen oval. There is a hole. Just a minute. Yes, Kadara. Poa niambie. Yes. Oh, okay. Nikupigie tafadhali within that. Okay. So we've seen that blood has reached. It has come from the liver of the mother and it has reached here. How does it go now? Instead of going to the lungs of the child, because the lungs of the child are not working, there is a hole that blood comes from here to here. The hole is called foramen oval. Foramen oval. The hole is called foramen oval. Let me write down. Please, let's go slow on that. It is called like this. Foramen oval. Foramen oval, because foramen is a hole. So when it goes through that hole, it comes here. There is, sorry. There is another thing called ductus arteriosus. Ductus arteriosus. Remember, from the liver to here, to that hole that a child has in the womb, now blood goes to another one called ductus arteriosus. From the pulmonary artery, you get it, to the outer. From the pulmonary artery to the outer. You understand? Blood flows from the pulmonary artery to the outer. Now we have another hole again, ductus arteriosus. This one and this one have a hole. Blood has bypassed, has come here, and then it has come from here. Is anyone seeing better? Yes. From here, it is going to the outer, to the systemic circulation. Yes? Now, ductus venosus, where it is jumping the liver. You get it? Now, blood has come, it has gone through the hole here, and it has gone to the outer. If it has come to the outer, eventually blood will go to the system of the child, because the outer is the one which takes blood to the system. You get it? It's not like the normal. The normal is blood is coming inside, it goes here, it goes to the pulmonary artery, and then goes to the lungs to be oxygenated. From the lungs, it comes to the left atrium, to the ventricle, then it is pumped to the systemic. But in a child, the ventricles are working. These ventricles are beating because they need to push blood. You get it? Uncle, Uncle, I know you know who Beatrice is. Say hi to Beatrice. She's here. Uncle knows who Beatrice is. Let me not say. Uncle, you know who Beatrice is. Say hi to her. Beatrice Kaloki. She's here. Now, let's continue. Blood has come here. It has bypassed the liver, come here, gone to the left atrium, and then from the left atrium, it has gone through the ductus venosus here. Ingre, Beatrice is a special person to me. Let me not say much. He's a special person to me, Judy. Now it has gone here, and when it has gone here, there is a hole connecting these two pipes. So it goes to the outer and down. Yes, I know. She takes me around too. Okay. Now, Uncle, have you understood that? Instead of blood coming from the here to here, then goes to the pulmonary artery, from the pulmonary artery to the lungs, then comes back, oxygen here, here to the left ventricle, then goes to the outer, and then the outer takes blood to the body. This is different. Blood from the liver of the mother. Blood from the liver of the mother, the umbilical vein, bypasses liver through something called ductus venosus. It bypasses through the liver, enters inferior vena cava. Now this is a child. Reaches the right atrium. Instead of coming to the ventricles, it goes to the right atrium. And from the right atrium, it goes to, that hole is called, now, Uncle, what, yes, I'm understanding. Yes, Uncle, that hole that you are saying that he was born with or she was born with is called foramen ovale. That foramen ovale is where blood goes through the left atrium so that it can come to ductus arteriosus to reach the here, and then it goes to the system. You get it? Now, what happens when a child is born? What happens when a child is born? When a child is born, that child cries. When a child is born, that child cries. Please listen to these mothers. Why do we, when a nurse is with you and moving around with you and a child has just come out, they always ask themselves, has the baby cried? Has the baby cried? Have you heard the cry? Please tap the child so that we can get the cry. When a child cries, this is what happens. The foramen ovale closes. Although it may not close completely, but the force of cry makes the foramen ovale to close. Now, when it closes, now the child has started using the normal circulation. When it closes, now the ventricle pass blood directly to the pulmonary artery, and the blood goes up to the lungs. The lungs of a child, when the child cries, they open up. And then they do what? They start the exchange of oxygen, and the cry is very important. And that's why you always see the nurses asking you, the cardiologist, the gynecologist in ward, has the child cried? So when he cries, the lungs open, the foramen ovale partially closed, or it can close within 3 days. Now blood does not go through the right atrium to the foramen ovale to the left atrium. It now gets a way to go round to the pulmonary artery, and it gets a way to go to the aorta. So guys, you see, the problem is when that foramen ovale and ductus arteriosus, they don't close after some time. If they have not closed after some time, okay, thanks. That's why a child cries. Yes, uncle, I see you are emotional. You are emotional. They are normal physiological cries. Normal. And we feel nice and we clap at the maternity when a child cries. We feel life has given us everything. You get it? Now, you as a child whereby this foramen ovale did not close, it means now you are not getting, you are out of your mother's womb, we have cut the umbilical veins. Now you are not getting the blood flow from the mother. If you are not getting the blood flow from the mother, it means you should not have a circulation that is Uncle is always, you should make loud noise and and clap your hands. Now, what happens is when the foramen ovale has not closed, what happens is this: the ventricles are pushing blood, and some blood, instead of going to the pulmonary artery, it is going round. So the blood that is going to the pulmonary artery to the lungs is very little, and it is coming down with the low oxygen, because as this ventricle is pushing, some blood is coming to the right atrium. And when it is coming to the right atrium, this ventricle is pushing. Sorry, you're not seeing. What I'm saying is, as blood is being pushed, this is a child now has the hole that has not closed. That has not closed. As this ventricle is pushing, the blood, some of it is going to the pulmonary artery to the lungs, and some of it is going back to the left atrium. So oxygenated blood that is coming in is mixing with deoxygenated blood through the foramen ovale. And then it comes here, and when it comes to the left ventricle, as you push, the same process goes on. This deoxygenated blood, some of it is coming here. It is meeting oxygenated blood instead of the whole of it going through the pulmonary vein to go to the lungs to get oxygen. So this is a very continuous process. And when it is a continuous process, what happens? What happens is the child is consistently having low immunity. The child is consistently having infections, because without proper oxygenation, you will have infections. Your body does not have immunity of fighting those infections. Without proper immunity, without proper oxygen, metabolism will come down. You will not fight. You will not have proper metabolism. So your energy production will come down. And when your energy production is coming down, what will happen? Always infections. Always infections. And infections are called the first thing of confusion of the body. Inflammation comes in. So, uncle, I know you saw this child was always weak, always having infections. Welcome, Agnes Thomas. Welcome to the platform. Thank you so much. Let's like the video as we continue educating people about these things that I'm talking about. So, uncle, I know he was always weak because low oxygen was there. Please like the video as you're coming as we continue. He was having low oxygen. Always, this child was fatigued. He was having low immunity because metabolism was down. Tissues were not working as normal. This child, greetings, Dr. Benjamin and everyone. Thank you so much, Herbs and Spice, to be here. Even if you have come late, it's a good thing. Yesterday, we were with Herbs and Spice on call, and people really enjoyed it. Herbs and Spice is a good person. You saw that. People appreciated you talking to me on call. Thanks a lot, Herbs and Spice, of being here. Yes, because we have been together. Yes, those are the problems that this child, I think, uncle, I have explained how the whole came and the problems that are being brought. Because now, if oxygenated blood is mixing with deoxygenated blood, what do you think will happen? You will not have enough you will not have enough in your body. And that's why that child died. That child really need urgent surgery. I wish I was there. I wish I was there those days. But it's okay. It's God will and everything is done. Thanks, Uncle. I think I've answered that question. So anyone else with any question? Anyone else with any question that you may be interested in? I'm waiting for any question. I have 15 minutes or 10 minutes. Anyone with any question that we can check it on, please ask. Anyone with any question? I've answered. Uncle, have I answered that question well? If I've answered that question well, please tell me. And anyone else who is oh, okay, I see Margaret. Margaret, you said you don't take alcohol. Okay, okay. So I didn't see that. Another great presentation. Thanks a lot. This is now called cardiology. Introduction to cardiology. I think you did not. I was not born at that time. Yeah. Thank God has all the why He does things. So we don't panic when we see some things. We don't panic. Yes. Now, anyone with any question concerning parasympathetic tachycardias? Today we have learned so many things. Today we have learned a lot of things. We have learned about arrhythmias. Yes, we have learned about arrhythmias, and we will learn again. Yeah. We have learned about arrhythmias. You see, those are things God put you here for a purpose, man. Uncle, you have started answering I know so many people have started answering their questions about what has been happening to their lives. And I'm so happy that I'm trying to unveil some problems that people have been facing. And yesterday if you have not watched yesterday night at 10, about the recovery of our friend after COVID, please go and rewatch that thing. It is so emotional and it is so nice. Yes, you see, I have the problem and I have been under medication since I was a young. Yes, Judy. Okay, sorry about that. We are sorry about that. What is the problem? You have foramen oval or it partially closed. Please tell us if you are okay. But if you are not okay, we can talk in private. It's okay, Rich Sue. Rich Sue, we have really learned a lot. We have really learned a lot, and people have learned so many things from automaticity to from the Kent bundle. People didn't know you can be born with a heart that is firing 2 times. Today, there are some people who are born with hearts that are firing 2 times. They are firing from this side and they are firing from this side. So anyone with any question, please, it has been a good session. I still have some time. Yes, like 10 now, 10 minutes. Who has any question? If you have not watched our live session when we were on call with Herbs and Spice, please go and rewatch that. Please go and rewatch. It is so emotional and it is nice seeing someone recovering from COVID to working out, doing everything to make life comes back to normal. It is emotional and we feel good when life is preserved and people smile. You see, please go and rewatch. Herbs and Spice. She's here. You see, so I'm waiting for any question. Yes, me too. We'll have to catch the rewatch. Herbs and Spice, you want to rewatch? You want to watch yourself explaining and asking questions? It's nice, eh? It's nice. Any hole in the valve, they call it rheumatic heart disease. Okay, rheumatic heart disease. If not today at night, I will. That topic is important. I have to do it before I finish this, the conduction system of the heart. So I think after we have dealt with the conduction system, maybe tomorrow, as we will start with tomorrow, the live of tomorrow, we will start with the rheumatic heart disease, and then we start dealing with recorrecting what we have done, the tachycardia and the tachycardia and the bradycardias. So tomorrow, King Ray, please don't miss tomorrow's, because tomorrow's we will be dealing with rheumatic heart disease. Very important. And then when we deal with rheumatic heart disease, we start now treatment of these arrhythmias, treatment of the Kent problems, treatment of how a hole in the heart can be corrected. So that we start treating rheumatic heart disease and then we come back to treatments of this. So tomorrow, be ready, everyone. We will be dealing with, and I might go on a call with if Judy will give us a chance, I can go on a call with her so that as we are presenting the problem, we are discussing with her, so that at least she knows. But if she'll feel so tired, we can just take it private, then I'll present. Okay. So everyone, let's pray for our friend who has been always with us, who is Dr. Ben. You should do StreamYard. Yes, I think I should do StreamYard. I think, yeah, or OBS. There is another one which is called OBS, but StreamYard is good. I think tomorrow we will see how we can do that. Anyone with any question before I leave now? Please ask Dr. Ben questions. Let's not just listen. Let's be interactive. Let's get to learn. Let's like the questions we usually ask. They really motivate. You get it? They really motivate. So today has been a very good session. If you have not understood about the cranial valves, the cranial nerves are nerves of the head. Cranial nerves. Let me just go through them before I finish, because that one is something that that always confuses people. Cranial nerves and cranial. In your head, you have nerves that helps everything in your body to work. Nerves that help everything in your body to be controlled. You get it? So these nerves, they control, like swallowing, they control. Now we have olfactory. When you smell, there is a nerve that helps you to take that to the brain and interpret it. It is called olfactory. Optic is for vision. That it comes from your brain to the eyes, sensory of the eyes. We have oculomotor, eye movement, pupil retraction, types of motors. You see, oculomotor is oculi. Oculi means the eye, how you look at things. You see, and then we have trochlear. Trochlear, your eyes can deep breathe help the heart. Yes, deep breath helps the heart in the manner of it produces parasympathetic. You remember what we talked about parasympathetic? So it makes parasympathetic to come up, and then you relax the heart, because parasympathetic, we said, the vagus nerve number 10 produces what? Acetylcholine, and a lot of acetylcholine, when you breathe, it relaxes your heartbeat. Doctor, I know of a child, she was born on this Down syndrome, and she have a hole in the heart. She was born 1994, and she's still alive. Yes, people live with these conditions. So you have seen someone in the group has said she was diagnosed with it, and she has rheumatic heart disease, and she's still living. Now, we continue with that is cranial nerve number 4 from the head. Trigeminal is another nerve. When you feel sensations of and you chill these muscles, it senses them. Abducens, cranial nerve number 6, lateral eye movement. When you want to look there, and you don't want to turn your head, you do this. So that is cranial nerve number. That is cranial nerve number 6. We have facial nerve. Facial nerve for taste and facial expression. So the nerve that helps you to facial nerve. When I'm smiling and I'm laughing, I'm being helped by cranial nerve number 7. It is taking signals to my head and telling me this is a happy feeling. When I'm cranial nerve, facial expressions, cranial nerve number 7. Vestibulocochlear, anytime you feel like cochlea means balance. So that one is in the ears. Your ears for hearing and balance. So it helps you to hear. Cranial nerve number 8. It takes some signals in the brain, and then they come back to the ears for you to interpret hearing and balancing. Those are called the cranial nerves, number 7. Glossopharyngeal. Glosso means the tongue. So glossopharyngeal is for swallowing and taste. Vagus nerve, number 10. Our friend, vagus nerve, number 10. That one I will not talk about it. You have seen. It is a mixed nerve, and it does very many things. Controls heart, the gut, mixed, even parasympathetic. You have seen. It does so many things. Accessory nerve. When you ask a child, can you come here? I want to send you somewhere, and she does not want to, he does not want. The child will do. So the accessory nerve from the brain is what is making this child to do this, to shrug your shoulders. And then the last one is hypoglossal. Hypoglossal is for tongue movement, When I'm removing my tongue, you see, those are the cranial nerve. And then we have the other nerves that come from your backbone that are called, their origin is from thoracic to lumbar, from your backbone. What are they help you to fight and flight, for action. Sit down, run, all of them we will learn one day. So I've explained today cranial nerves, what they do, but we have the sympathetic nerves that helps you to. So we have said from sympathetic nerves from your backbone, the bones, every bone has got a nerve that comes outside. Those from the first bone down here to the fifth bone, they are called sympathetic nerves that are helping the heart. Cool and cute. God really makes our bodies very special. No man can ever don't care what men do. Yeah, yeah, very true. Who is left? I'm just left with one like and then I go. One like, guys, one like, and I go. To make it 20. To make it 20 and I go. But I think what causes heartburn? Oh, heartburn. Heartburn is caused by regurgitation. 20 is there. Heartburn is caused by when you take acidic food. When you take acidic food and you have reflux. Now, let me explain about that. Let me put this one first and then I explain about that. Now, Betty has asked about heartburn. What causes heartburn? What causes heartburn? When you take a food and then they go to your stomach, there are some hormones that are in your stomach. Hormones that are in your stomach. Hormones that are in your stomach. In your stomach, we have some hormones. Just a minute. Just a minute, Betty, just a minute. I want to explain what causes heartburns and how it comes, because some people get chronic heartburns and they don't know why. Every time you take food, you get a heartburn. Now, what is this? Something is wrong here. Just wait a minute, guys. Just a minute. I want to answer that question. Oh, thanks, Betty. Betty's World. Betty's World. Betty has given me a like. I like that. Now, there are some cells in your stomach that are called parietal cells. Those parietal cells, they stimulate some process called gastrin, and they produce something called, they have H2 receptors, which increases HCl, hydrochloric acid, in your stomach. You see, when the same vagus nerve we have talked about is irritated, now you receive when you take food that is acidic, you feel like food wants to come back and choke you. So it is called a reflux. Reflux is when you have acidity and it is coming up to the body. How does this reflux come? Sorry. How does acid reflux come? You know, when you have acidity, that is what makes you to get the heartburn. So when you have a lot of acid, some of it will want to come out, and that is what is causing you. It is choking you here. So that is what causes heartburn, and many things that can bring what can bring this problem is eating foods that are acidic, taking alcohol. Others, like infections like H. pylori, can cause acidity in your stomach. So many things can cause acidity. Delayed emptying of your stomach. Delayed emptying, when you're taking food, it's called gastroparesis. You are taking food and it is going so slow and you are not emptying. It can cause that. So guys, we are over 2 hours. I think we have no many questions. I think that one I've answered it as it is. And let me check. Is there any other question that I've not answered? Is there any other question that has not answered? I think we have all answered the questions. Thank you so much for tuning in about here. We have another session which is important for rheumatic heart disease. It will come tomorrow as we deal with now treatments. I have explained everything about your heart beating fast and your heart beating slow. If you have a position that you really want me to express and emphasize, please tell me, but you can go through the videos and check all this process slowly by slowly. And then tomorrow we start the treatment. Thank you so much for treating. And for those who will meet when I'm meeting Jamaican uncle at his channel, let's meet there. But for now, it is 6:30 in the morning, in the evening, PM, 18:30 PM. Bye. Have a blessed day, and good night as it is coming. Thank you so much for tuning in. God bless you, everyone. Bye. Okay.